Tailgate Talk, brought to you by SouthernBone&Joint specialists.
I'm here with Ashton White, kicker for Wicksburg Panthers. Thanks for taking the time. You've been kicking since 7th grade. What started to kick for the varsity team?
Well, the football coach approached me at one of my brother's baseball games, and I had just come from soccer practice, and he asked me if I kicked, and of course I was like, yeah, I kick. And he said that they needed a kicker, so I came out one weekend and I tried it, and we sent him videos, and he was like, okay, you're the kicker now. And that's kind of just how it started. They all kind of treat me like I'm the little sister. They protect me and all, but we'd scrimmage against guys, so I'm kind of used to them being rough, but I haven't gotten hit yet, so I'm not that worried. I'm confident in our line. I just want to help my team out. I want to help them get as far ahead of the opponent as possible, score as many field goals as I can.
So what about the range? What you got? What you got in your arsenal?
I've got, my farthest I've kicked is a 38-yard field goal.
Yeah, it's easy, right? All right, well, I'm going to do it then. Oh, let's go. That's all we have for Tailgate Talk. Thank you so much. We'll see you next week.
Your Tailgate Talk tip, brought to you by SouthernBone&Joint specialists.
The most common hip injuries that I see, especially toward the beginning of football season, are hip flexor strains. These are usually partial tears or a strain of the hip flexor tendon. It's commonly seen in running, and sprinting, and kicking sports such as football and soccer. These rarely require any surgery. We typically treat these with physical therapy, rest, and anti-inflammatory medication. Most of these athletes can get back to the playing field within 2 to 6 weeks. When an athlete has pain that lasts longer than a few weeks, this should be evaluated by a doctor or their athletic trainer. These can sometimes be a sign of hip impingement, where they have some bony overgrowth over either the ball or the socket, and this can lead to a tear in the labrum, which can cause long-term damage of the hip and can lead to some early arthritis. These are treatable, oftentimes with therapy, and sometimes it does require surgery, but our goal is to get the athlete back to the playing field as quickly and safely as possible.